Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Eliza Andrews, who is the owner of InSpirit Therapy Associates based out of De Pere, Wisconsin. As a physical therapist and pelvic health clinical specialist, Eliza considers herself a puzzle solver for her patients, and she loves helping people find the root cause of their symptoms. She discovered early in her career that a whole body approach was the key to quicker recovery, so her practice combines traditional treatments with lifestyle management, nutrition, and emotional support. In 2009, Eliza became one of the first PTs in the nation to earn the Women's Health Clinical Specialist designation, and she has been a leader in the pelvic health therapy world ever since. When Eliza is not helping patients, you can find her working on a DIY remodeling project, reading, or spending time with her husband, kids, or grandkids. In our 4 episodes together, her experience of over 30 years shines through as we discuss numerous topics related to pelvic health therapy, including an overview on what pelvic health therapy looks like, symptoms specifically related to kids like bedwetting and constipation, how pelvic health therapy can help treat reproductive challenges such as endometriosis or irregular or painful periods, and how pelvic health therapy can be a game changer for women in the childbearing years. Get ready to learn a ton? Here we go with today's conversation.
Hey guys, we are back with InSpirit Therapy. We are super excited to talk about this topic in particular. We're going to be talking about dysfunctional menstruation, endometriosis. We're going to be talking about different ways that physical therapy can actually help you with these types of dysfunctions and reproductive issues. So, Eliza, can you tell us and give us an overview onto the conditions that you help with in this area of reproductive dysfunction?
Sure. So pelvic health therapists treat any kind of reproductive health issue, really. Okay. We do work with people with infertility, helping prepare the body for all of the treatments that are going to come. If someone has a history of endometriosis, they adhesions that are there either from the endo or from the procedures, if they've had a lysis procedure, if they've had a debulking, if they've had some of those kinds of surgeries. The laparoscopic procedures even can lead to scar tissue. If that scar tissue is tight, that will restrict the ability of the organs to move into the correct position to maximize fertilization. So we can do that. That's a treatment called visceral manipulation. There are some specific kind of visceral manipulation that are for infertility. So therapists who have training in that. And that's what you'd want to look for as a therapist that specifically has training in the area of visceral manipulation. We can work with painful periods. Again, it's the same thing. It's the inflammation. So if you think of an inflamed joint, it makes sense to go to PT. Well, if you think of an inflamed organ, it also makes sense to go to PT or OT, as long as, again, those therapists have the training. So it's finding the people who know that who've been trained in those areas. We do work with premenstrual adolescents. We can help with that if someone is having problem with their periods being really painful, if they're missing school, if they're not going to work, if they're laying in their bed for half a day wanting just the heating pad. Those are things that are not normal, and it means there's something going on. Sometimes it is that the organs are restricted and not moving well. Sometimes it's orthopedic, so their pelvic muscles are really tight. Believe it or not, we see that in gymnasts, dancers, and people who do a lot of horseback riding. Those are kind of just some of the areas we see it. you mentioned PCOS as a possible cause. We can treat people who have PCOS to help them with their pain management. And anybody who has had any kind of treatment for a reproductive cancer or any other, other medical condition that resulted in a change to their menstruation.
Yeah. So, I mean, it sounds to me like if you have any of these conditions or painful periods or anything like that, I mean, you should go see a pelvic floor physical therapist or occupational therapist that can help you. I mean, it doesn't seem like you should wait on this.
Yeah, no, and we will work very carefully with your other providers. So a lot of times when people are having a lot of discomfort around their period, they'll go see their providers, their MDs or nurse practitioners or whatever. And the first line is usually, well, let's see what kind of medication we can put you on.
Right.
Whether it's something like a NuvaRing or an E-string, or it's an oral birth control or an Nexplanon, or I don't care what it is. But the minute we start changing the hormones in your body, we start changing every symptom in your body. So, and sometimes, yes, that's warranted 100%. But it's not necessarily the only part of it. So we have to work together as providers and figure it out. My favorite is when someone comes in and they've been put on a medication and we can get rid of that.
Yeah, absolutely. And there's a lot of people that don't want to be on meds or can't be.
Right? Yeah.
And
because the side effects of the medication give them something else, right? The other thing is it's not just abdominal pain. There's a lot of people who suffer with headaches around their periods. That's very, very musculoskeletal. That is very related to the changes, the actual physical changes of the uterus and the supporting ligaments of the uterus and how they connect into the pelvis. So pelvic headaches are a very real thing. Menstrual headaches are not only hormonal. So when people come in and they're like, oh, I get severe migraines around my period and I've tried every kind of birth control. And I'm like, yep, it's not that.
That is so interesting. About a lot of people don't. I know for me, I only get backache, and I can understand that, but it's just very interesting how everybody kind of reacts differently.
If we back up a little bit, I would love to hear what is normal and what's not for a period. Are our periods supposed to be completely pain-free? We're supposed to feel completely normal, or is a little bit of discomfort normal and would not be a reason to see a pelvic health therapist?
Yeah, no, I think everybody's a little bit different, of course. But yeah, to be uncomfortable is one thing, but it should be something that lasts, I would say, less than a day. And it should be something that you're like, a single Tylenol will take care of it. If it's something where you're grabbing 800 milligrams of ibuprofen, no, that's more than you should have to put up with. There are a few exceptions to that, but for most people, yes.
I would also say too, if you're having super heavy periods, that's another sign.
Right. Yeah, and so when patients come in, often there's no medical diagnosis. So we'll help them track that down a little bit and help them find providers that can address that. Especially in the young girls, the teenagers, they come in, and I'll give an example. We had a young lady who was given birth control to help her with her headaches. Well, that gave her all kinds of other things, right? So the goal is, well, let's get you off the birth control. And they were doing, what were they doing with her? Oh, she was doing the shots. So she was so she wasn't getting a period.
Oh, well,
and I'm like,
how are you supposed to?
So what is that doing to your body? When we start depriving young bodies of the hormones they need, we are setting them up for a lifetime of osteoporosis, increased joint pain, muscle dysfunction, organ changes, potentially infertility. We don't know the rate of infertility in this country has quadrupled in people between my age and so between 30 and 50. And I think it's because we've just willy-nilly been putting people on birth control and changing the way those ovaries work. And I don't know.
Yeah.
I'm not a big fan of that.
Yeah, right. Yeah.
I love that you are looking to have a natural approach to helping women with these symptoms because, like you said, the symptoms themselves of what we're talking about here, and even endometriosis, things like that, they're pretty common nowadays, and a lot of women need help with that. How much do you feel like painful periods or endometriosis or PCOS, these things are genetic.
They're very. So something that everybody needs to know, if you have endometriosis, you are born with it.
Oh.
You don't acquire it. It does not grow in your body. You're born with it.
So it's nothing you did wrong?
Nope, absolutely not.
Yeah, nothing you can really keep, you can lower the symptoms, but you can't just keep away.
So
is that true?
Well, so basically what happened is when your body was developing in utero, the cells that should have landed in your little uterus landed somewhere else. They just didn't land in the right place. That the endometriosis is, the more and more and more we study it, the more we know that it's genetic. You'll hear it now. So a woman in her 30s who's being diagnosed with it, when she mentions it, her mom will say, "Well, I had periods like that, and my sister had periods like that, and grandma had periods like that," and you'll hear it. The familial tendencies. It's not surprising to hear, to have sisters or cousins, all have that. So we are understanding more and more about the epigenesis and the actual developmental reasons for these diagnoses: PCOS, endometriosis, all of those. And as they understand that more, that's leading to better treatment. 30 years ago, not even 10 years ago, they were still doing hysterectomies. Well, why take out the part that doesn't have the problem? Because endometriosis means the tissue's outside of the uterus.
Oh, okay.
So doing a hysterectomy was pointless.
Yeah.
So, it's in the last 10 years that treatment has really improved.
Okay, that's good to know.
Mm-hmm. One thing I would mention is for those who are struggling with endometriosis, there's an event in March. It's called the Endometriosis Summit. It's a multi-collaborative physician, nurses, PTs event that goes on in the United States, and it is free for patients to attend either virtually or live. So Google Endometriosis Summit 2025 and get some information if you're interested.
And maybe we can get a link from you and we'll just put that right in the show notes.
Sure,
too.
That'd be great.
Perfect. So in my head, I think about physical therapy as the traditional route, right? So like you come in, you get exercises, you go home, you have your homework exercises. You've talked a little bit about how you can help with scar tissue and you can help with like that the visceral manipulation and helping making sure the organs are in the right places, things like that. What else is in, like, what else does it, can you tell us what an appointment looks like when they're coming in for physical therapy for these types of symptoms?
Sure. So when someone comes in for pelvic therapy, the intake is going to be pretty detailed. We're going to talk about when periods started, what they look like, how they've progressed, how they've changed, what they were like, if it's an adult where there was a pregnancy in there, how were they before, how were they afterwards. But when we address someone, we're going to talk about everything from so that we'll go through all the physical stuff. We'll look at hip range of motion and a low back range of motion. We'll look at the position of the organs. We'll look at the pelvic floor muscles. Because when the pelvic floor muscles are really, really tight, they change how the pelvic organs function. They change the blood flow to the organs, and organs that don't have good blood flow are not happy organs. So a lot of times, if someone, we look and we see a lot of like swelling in the legs, they've got a lot of edema. Well, that tells me that their lymphatic system isn't draining. If your lymphatic system isn't draining well in your abdomen, you're going to have tons of bloating and pressure, not just when you have your period. You just have more when you have your period, but it means it's always there. If it's always there, that means that those organs are not getting cleaned. Like they're not getting, flushed the way they should. So that might be something. We might send them for some lymphatic therapy, or we'll include lymphatic therapy. I do some of it, but we also have a specialist in our clinic, but we'll do some lymphatic therapy in addition to the manual therapies. We also will talk about nutrition. We'll talk about supplementation. We'll talk about magnesium levels, vitamin D levels, flaxseed. We'll talk about hormone regulation. We'll talk about sleep. We'll talk about stress. We will talk about activity levels, because all of those things matter when you're trying to combat something that's an endocrine imbalance, like any one of those reproductive issues.
Tell us more about the flaxseed, because that was an interesting little, very specific item that was in your list.
So some of this stuff is so easy. Like flaxseed is actually a natural way to release stored estrogen. So estrogen is stored in our fat tissues. And no matter how skinny you are, you still have some of it there, and you're supposed to. But if you have too much of it and it stays there for too long, it puts you into an elevated estrogen storage system, and that's not good for our organs. So a little bit of flaxseed in your smoothie every morning, or put it on your yogurt, or however you want to take it, can help release estrogen. And not only will it make your periods feel more comfortable, potentially, increases our sexual response.
Oh, there
Wow.
you go.
Yeah.
There's a little tidbit.
Super interesting.
Oh, I got a whole bunch of those.
Maybe we should have a 5th episode about
Yeah.
that, huh?
No, that's really interesting. This is going to take a little bit of a spin-off, but it's a question that I've had for a while. But do tampons, cups, discs, like one of them, all of them, in any way affect our pelvic health?
So if you have a tendency to having hypertonicity in the pelvic floor, which means if your muscles down there are tight, if they are restricted and not moving well, excuse me, and you use one of those devices, they can tend to increase that tension. But if your pelvic floor is healthy and everything is working, no.
Okay. Yeah, no, that is helpful just to have a little bit of an understanding on that, because with the cups, I oftentimes wonder, does that create any sort of like suction? Or I actually have never used a disc, so I don't really know how those work.
Yeah.
And then obviously tampons they've been around for a long time,
Mm-hmm.
but those are the ones that tend to give you like a feeling of heaviness if it's not in like the proper position.
Correct.
So,
But if any of those are giving you a problem, it's probably a pretty good indicator that there is something going on in the musculature of the pelvic floor that needs to be addressed.
sure.
And they should come see you.
Well, they should see a pelvic health therapist.
Right.
Yes.
Yes, absolutely.
How would a woman know if she has a tight pelvic floor?
I was just going to ask that one. Yeah.
Pain is usually the first thing. So if sex is uncomfortable, or inserting a tampon or disc or cup is uncomfortable, that's probably the first thing. Constipation, stress incontinence, where all of a sudden you move and you leak and you're like, why did that happen? So there's a misconception that leaking is a sign of weakness. Most often, leaking is a sign of tension. Because when muscles are too tense, they can't contract correctly, so they can't stop the leak.
When we're talking about pelvic health therapy for these specific challenges of painful periods or endometriosis, is treatment long-term? Is it short-term? Like how quickly do you see changes and results in how you feel?
I mean, I have patients who are better after one visit. Like they'll come in and something's changed. I would say it varies. It varies on the age. It varies on the severity. If it's an endo patient that's had it for a long time and they need to have a surgery or something like that, they might be coming a little bit longer. I do have some patients that I'll see them 4 or 5 times and they've learned everything they need to learn, because education is huge. Teaching people to be empowered to manage these things on their own is our goal, always. So we'll do as much education as we can, and we might only see them for a few visits. Might see them back later, like after a baby or when they're pregnant, other things. But yeah, as a general rule, no, it's not a long-term ongoing management thing unless there's a change in health status.
Well, one thing you said was, you have somebody that comes to you for, something like this, but then they come back to you after pregnancy. That's a point too, is that your pelvic health doesn't, just because you fix it once, doesn't mean that something doesn't change later.
Right.
Right.
And I've got a lady, she's kind of funny. I saw her before she had her first baby. And then I saw her after birth of all of her kids. She had 3. And now she's coming to me because she's going through menopause. And there's a lot of things we can do to manage menopause. And she's like, you were my first stop, because if it has to do with down there, you're my person who's going to answer my questions. So sometimes I've been doing this long enough now that I've seen some people through all of their life changes.
It's amazing.
Let's just, before we close out this episode, I do want to just sit on that topic really quick though. So how can you support a woman going through menopause?
Oh, that's a big one. That's a whole session. I just actually finished a menopausal certification, but we help with, again, the same things. Pelvic floor tightness, which is related to estrogen decline. When you have a decline in estrogen, it changes a lot of things. We will talk about bowel function. We'll talk about bladder function. We'll talk about sexuality. That's probably the biggest one, is maintaining your sexuality once your estrogen declines. So there's exercises for that. There's mobility things for that, mental health support. And then if we need to, we'll advocate for them to get the things they need from their physicians.
Perfect. You're their wellness advocate,
It's huge.
I love that.
I look at it as educating. Last week I had a lady came in and she needed some vaginal estrogen, and she asked her doctor, and her doctor's like, "Oh, you're supposed to age gracefully," is what he told her. So the next day in his email, he had 16 studies citing the need for vaginal estrogen in postmenopausal women.
I bet. That's the thing is with you go to bat for your patients too. Like you're not afraid to professionally share information.
Right. Well, being in private practice, I can do that because I don't have to worry. I don't have to worry that I'm going to get in trouble for helping my patients.
Yeah, absolutely. I love that.
And you can rest well at night knowing that you didn't just leave them hanging. Like they are getting the information that they need. And if they're not getting it from someone else, like you will make sure that those people are getting educated. Going back to what we talked about in the last episode, like you're not only educating your patients, but you're not afraid to like help educate other professionals as well, because you do have a lot of experience.
Well, if you educate a professional, you don't help one person.
Right.
You help
exactly.
many.
Yeah.
Yeah. That's a great point. This was we covered a lot in this episode, and I feel like this is just a really interesting topic because I'll be honest, like Dre and I have worked in the pelvic health field in the personal training realm for quite a long time. And when it comes to like painful periods, I don't know if a PT would be the first person I would think of to go to.
Well, now I do.
Now I do. So this was just a really insightful conversation that I feel like was really awesome for so many people to hear.
Absolutely.
But in our last episode together, we're going to be talking specifically about what you would think about for pelvic health therapy related to the time of trying to conceive, through pregnancy, and into postpartum, and how a pelvic health PT should definitely be part of your team for that. So stay tuned for their next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.